Hello, my name is Eveline Tira Remy and I am going to read the exercise chapters 14 to 23. Chapter 14, Symptoms and Signs. Exercise 1. Complete the table with words from the opposite but stress marking form of the stress syllable in each word. The first one has been done for you. None. Exhaustions, adjective tired. None. Fatigue, adjective exhausted. None. Lethargy, adjective worn out. None. Tiredness, adjective tired. Exercise 2. Make word combinations in a word from each box. Look at A, B, and C opposite to help you. 1. Complain of. 2. Of color. 3. Out of sorts. Out of sorts. 4. Present with. 5. Put on. 6. Worn out. Exercise 3. Complete a sentence with the correct form of the verb present. 1. A 67 years old man presented with 9-month history of increasing shortness of breath. 2. The most common presentation, a loss of consciousness. 3. Cranial arteries may present a fever without obvious causes. 4. The patient's usual presents with a severe sore throat. 5. The presenting symptoms in this patient could perhaps be due to renal failure. 6. Other conditions with a similar presentations include acute cholecystitis. 7. Reduced growth is an important presenting complaint of celiac disease. 8. 2 months following presentation, the patient was able to walk. Exercise 4. Read the patient's descriptions of her symptoms, then complete the case report. Look at the opposite to help you. Case 13. A 50-year-old housewife who had been well ill for months previously complained of tiredness and malaise. She has gained 9 kilograms in weight in the year before she presented to her GP. Allowed she denied eating more than usual. She was constipated and she noticed that her eye had started to fail out. Chapter 15, Blood. Exercise 1. Find words in the box with opposite meanings. Look at B and C opposite to help you. Adequate with inadequate. Against with for. Severe with mild. Common with rare. Insidious with sudden. Likely with unlikely. Exercise 2. Make word combinations in a word from each box. Look at B and C opposite to help you. 1. Bone marrow. 2. Differential diagnosis. 3. Insidious onset. 4. Iron deficiency. 5. Pernicious anemia. 6. Progressively increasing. 7. Vibration sense. Exercise 3. Complete the sentence. Look at A, B, and C opposite to help you. 1. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by vitamin deficiency. 3. The bleeding and purpura are caused by abdominal platelet functions. 4. The white cell count is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctiva is probably due to loudings. 6. There was a palpable mass and in the right upper quadrant of the abdomen. 7. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. 8. The anemia may be due to increasing red cell breakdown. Exercise 4. Complete the conversations. Look at the opposite to help you. Professor. What is against the diagnosis of pernicious anemia on a physical examination? Student. The problem started quite suddenly, so I did have the typical insidious onset. He doesn't have any skin pallor and he doesn't have symmetry or paresthesia or absent, vibration sense, and I call it Phyllis spleen. Professor, what about his tone? Student, his tone was normal and not inflamed or sore. Chapter 16, Bones, Exercise 1. Label the diagram using word from the books. Look at the opposite to help you. 1. Skull. 2. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Collarbone. 7. Shoulder blade. 8. Thigh bone. 9. Kneecap. 10. Shin bone. Exercise 2. Match the types of fracture with the descriptions. Look at the opposite to help you. 1. With the letter A, there is break in the skin with open. 2. With the letter C, the bone is broken into several pieces with comminuted. 3. With the letter D, the broken pieces are separated with displays. 4. With the letter B, the bone is bent, is occurs mainly in children with is wristed. 5. With the letter A, the broken pieces are pushed together. This is impacted. Exercise 3. Complete the textbook extract. Look at the opposite to help you. 1. Reducing a fracture involves training to return the bones to as near to their original positions as possible. If fracture is allowed held in displaced positions, the fracture will unite, but it may go on to malunion. Chapter 17, Childhood, Exercise 1. Complete the table with word from A and C opposite. Then complete the sentence with word from the table. Verb delay, non-delay, adjective delayed. Verb develop, non-development, adjective developed. Verb distant, non-distensions, adjective distended. Verb fail, non-failure, adjective failing. Verb nourish, non-nourishment, adjective nourished. 1. Babies with the fetal alcohol syndrome may present with failure to thrive. 2. Abdominal distensions may be due to an enlarged liver. 3. A small amount of alcohol in pregnancy can affect fetal development. 4. Mortality from measles can be reduced by better nutrition. 5. Delay in one or more of the milestone may be the first sign of disease. Exercise 2. Complete the sentence. Look at A and C opposite to help you. 1. After sittings, babies learn to crawl and tend to walk. 2. A child who has started eating solid food has been weaned. 3. Someone who is not very tall is said to be of short stature. 4. The stage in a child's development are known as the milestones. 5. A child who is beginning to develop sexually has reached puberty. Exercise 3. Write the common English name for each disease used in your medical knowledge. 1. Enlarged parotid glands is mumps. 2. Difficulty opening the mouth is logjeu. 3. Rash and enlarged posterior occipital nodes is German mestes. 4. Paroxysma cough with vomiting is whooping cough. 5. Papules and vesicles fierce hunting is chickenpox. 6. Cold and cold followed by rash is mestes. 7. Sore throat and rash is scarlet fever. 8. Swollen joints and a hair murmur is rheumatic fever. 9. Fever followed by muscle weakness is polio. 10. Cough with stridor is croup.